the whole point of yoga, or even when I'm using yoga therapeutically as a yoga therapist, is to bring the body back into balance. And so you'll hear this in a lot of different, you'll hear this in acupuncture, you hear this in chiropractic, you hear this in a lot of different integrative medicines, is that the point is to bring the body back into a balanced state, a homeostasis state where it can start healing itself, right? Because the body has all of these systems in place to, eliminate bacteria, to decrease inflammation, to balance everything out. So all of that is there. And so all we're doing with the different postures is addressing different aspects of the body to try to bring it back into balance. Bodies are complex things though. So what we haven't defined yet in yoga is, do this, and this for this condition. Do this, and this for that condition. What we often will look at is how things are manifesting, what that looks like in an Ayurvedic lens, because it's based in Ayurvedic medicine, and then try to bring that back into balance. And so there are some things that we can physically say, this is a prescription for yoga for back pain, right? This is what we do for yoga for depression because it addresses these hormones. It addresses, just kind of the equanimity of someone. This is what we do for somebody who has, a couple of physical conditions, but when it comes to the overall approach, it's really not about only these 3 positions to treat this thing. It's about having somebody have a change in their behaviors, as small enough and consistent enough change in their behaviors that there's a lasting change. What I've experienced in the, DoD hospitals and is that yoga is often used as an adjunct in the integrative pain management clinics. So there's enough research to support using yoga as an adjunct for somebody with chronic pain. I was also involved in a couple of different studies of yoga for back pain, yoga for PTSD in veterans, and yoga for back pain and neck pain in active duty. And in those research things, they were small studies, they're pilots, so we need to do larger studies. But there's indication that yoga does have a strong effect on lower back pain, right? Especially in veteran populations and active duty populations. And so yoga, addresses stress. So the level of evidence is building, right? It's not just a couple of small studies. The amount of research that's been done on yoga in the last decade has been more than has been done in all the previous years. It's quite large, but we're still refining those research questions and refining what the research is saying. Yoga's not going to cure your cancer per se, right? It's not a panacea for everything. And one thing that I hear people say is, oh, if I just do yoga, everything will just be good, right? We have medicine for a reason, right? We have allopathic medicine for a reason. And even as a yoga therapist who is an allopathic practitioner as well, I practice, I dispense, I prescribe medications and I do yoga therapy. So I am an anomaly. But for those who are strictly yoga therapists and don't have other medical credentials, there's a specific scope of practice and specific referral criteria. If somebody has refractory high blood pressure that's not going down, then they need to go see their doctor. If they have, cataracts, they need to go see their doctor before they even start doing a yoga practice. So there are different things that we want to make sure that we refer out. And so it doesn't cure all the things. And it also does not, in and of itself, relieve all the stress, right? The stress doesn't go away. The pain doesn't go away because you practice yoga. What happens is your relationship to the stress and your relationship to the pain and your interoception about what's happening in your body and in your mind is heightened. And so you're able to address that more intelligently.